Welcome to the overview of your medical scheme changes for 2022, brought to you by Nmg Benefits. This video highlights and summarizes the various options available on Fedhealth with reference to the changes in benefits and contributions for 2022. Nmg is an authorized financial services provider and is here to help you with your medical scheme membership. Our consultants are fully accredited with the FSCA, the Council for Medical Schemes, and your medical scheme. As one of the largest financial services intermediaries in South Africa, with more than 25 years of experience, we can assist with various elements of your medical scheme and provide you with sound, independent advice. Let's take a look at the benefit updates for next year. Fedhealth announced a weighted contribution increase of 7.4% with effect from the 1st of April 2022. To ensure a sustainable contribution increase in 2022, an average of 7.4% is required. However, Fedhealth will be paying the first 3 months of 2022, which in effect represents a 5.5% increase if calculated over a 12-month period. A 0% increase has been advertised for the first quarter of 2022. An overview of the changes includes the following. A new COVID-19 benefit will be available in 2022. A new income band has been introduced on the MyFed option from the 1st of April 2022. CPI increases on all benefits and co-payments from the 1st of January 2022. Mediclinic hospital network introduced on grid options. New stress and anxiety benefit. Mammogram benefit frequency enhanced. Enhanced oncology management program. Update in choosing your day-to-day benefits. And a new member mobile app. The new COVID-19 benefit in 2022 will include awareness and education in the form of ongoing newsletters, updates and information, as well as the COVID-19 support portal on the Fedhealth website. Prevention programs in the form of a weight management program, as well as a Go Smoke Free program. Fedhealth will also be offering oximeters to members if required. Members under investigation will have molecular, serological, and antigen tests available to them, which will be covered by the scheme. Doctor visits and screening will be covered from the Fedhealth Unlimited GP benefit, paid from risk. Virtual consultations have also been introduced to limit physical contact. A PMB care template will activate automatically when a member's COVID-19 diagnosis is confirmed. This covers consultations, pathology, radiology, and certain procedures like intravenous infusions and nebulization. Unlimited hospital cover, ambulance transfers, post-hospitalization physiotherapy, acute home oxygen, and the hospital at-home benefit will be available where members can receive treatment in the comfort of their own home. Mediclinic has been introduced as a part of the network hospitals on the grid options. Netcare hospitals will still be available to members on the grid options. A stress and anxiety benefit has been introduced on the FlexiFed One option. Virtual consultations with a psychologist will be paid from the risk benefit and not day-to-day benefits. An Hpv vaccine has been introduced for girls aged 9 to 14 and will be paid from the risk benefit. Mammograms will now be covered every 2 years from the risk benefit and will be available for all members from the age of 45 years and older. Fedhealth has introduced the South African Oncology Consortium, also known as SAOC, to the oncology network. Both ICON and SAOC are the preferred providers going forward, giving members access to most oncologists in South Africa. Using one of these preferred providers will ensure that members are not subject to a 40% co-payment. Fedhealth's unique structure allows members to choose a hospital plan with the flexibility to add day-to-day benefits through Flexi Medi-Vault. Medi-Vault offers significantly higher benefits for day-to-day cover in comparison to other savings account plans. Expenses not usually covered by medical schemes can be paid for via the Medi-Vault. Members are able to select a fixed or flexible Medi-Vault for day-to-day cover. Fedhealth have integrated their member app with AMP. Members will have access to this fun tool with a gaming element giving them access to real-time data to assist them to stay healthy, informed, and inspired. The app will calculate your personal health score, which is a summary of where the member's health is at, by tracking and measuring their well-being in real time from wearable devices such as a Fitbit, Google Fit, or Garmin. Discounts will be available for more than 7,000 reward partners in the Avo online mall. Avo is an online store that facilitates online transactions from start to finish with secure payment. Once registered, members will receive emails from Avo and AMP on the latest deals. Members will be able to apply for international travel insurance of 5 million rand directly on the app. The Dutcher pet insurance benefit has been expanded to include 3,000 rand accidental cover, 5,000 rand liability cover, and discount vouchers for pet food. All Fedhealth members will be offered a 30% discount on Dutcher policies. And now that we've gone through the changes for next year, let's move on to an overview of the 3 components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization may be limited or unlimited depending on the plan that you choose. This rate is reflected as a percentage of your scheme rate and will increase from 100% cover to a higher percentage depending on your plan choice. Planned hospital procedures need to be pre-authorized with your medical scheme by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. It is recommended that members carry their membership cards with them at all times. Members opting for one of the grid or elect options may need to make use of network hospitals in the case of planned procedures. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you're covered for hospital shortfalls. These shortfalls arise because there's no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value, and/or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in hospital shortfalls. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By way of example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should your doctor diagnose you with one of these chronic conditions, they will need to complete a chronic application form and submit this to your medical scheme. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list known as a formulary list to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment will apply. Chat to your doctor about the possibility of changing to a formulary medicine to avoid this shortfall. Members on certain plans may be required to make use of a designated service provider to avoid a co-payment on chronic medication. The screening benefit. Fedhealth offers members a comprehensive list of screening benefits which are paid from risk. These assessments are done to help members either prevent illness or address specific conditions they may already have. Let's take a closer look at your day-to-day benefits. The level of cover and the way your day-to-day benefits are paid depends on your plan. Fedhealth offers members a choice of 2 comprehensive options. The Maxima Plus and Maxima Exec option are aimed at members requiring comprehensive hospital and rich day-to-day cover with above-threshold benefits. The FlexiFed range of plans offer members 8 options which restrict members to using network hospitals for planned procedures at more affordable premiums. In the case of emergencies, members have the use of any private hospital. Members joining one of the FlexiFed options have access to Medi-Vault savings for day-to-day cover. MyFed is a capitated plan where members are restricted to using certain hospitals and day-to-day networks. Contributions are determined by your income. One of the distinct advantages of being a Fedhealth member is that all plans are underpinned by an unlimited GP benefit through a list of network GPs. Members are also covered for trauma benefits, paid from risk, and have access to a 7-day post-hospital take-home medication benefit, as well as a 30-day post-hospitalization treatment benefit that is also paid from risk. Other unique benefits include cover for female contraception, specialized radiology paid from risk regardless of whether it is done in or out of hospital, and child rates are charged up to the age of 27 and not the industry norm of 21. Taking you back to one of the significant changes made in 2021, you will know that Fedhealth's Medi-Vault System allows FlexiFed plan members to refine their contributions based on their need for savings to cover day-to-day benefits. Members will only need to pay for day-to-day benefits when they need them. On request, funds can be transferred from your Medi-Vault to your wallet when you need to pay for day-to-day benefits. The funds you transfer are then repaid over a 12-month period. While some members enjoy the flexibility of the Medi-Vault, having contributions that change each month, some members may prefer a fixed repayment structure, which provides them with certainty around what they'll be paying each month. Funds are transferred to your wallet on the 1st of January every year and are made available immediately. This allows for simplicity and security. Fedhealth offers comprehensive benefits for maternity and childhood benefits. Some of these include 2 antenatal scans, anti- and postnatal consultations, maternity support, a doula birthing coach, a newborn hearing screening, childhood immunizations, and pediatric consultations. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. The Maxima Plus option reimburses hospital claims at 300% of the scheme rate, Maxima Exec at 200%, and the balance of the plans reimbursed at 100%. On the chronic side, all plans cover the standard 27 chronic conditions, but you will notice that some plans have additional chronic illnesses that are covered, in particular the Maxima Plus, Maxima Exec, and FlexiFed 3 and 4 plans. The Maxima Plus plan offers members rich day-to-day cover in the form of a savings account, followed by an OHIB benefit which offers further cover. The member will then experience a self-payment gap before reaching additional cover in the form of an above-threshold benefit. The Maxima Exec option offers members rich day-to-day cover in the form of a savings account, followed by a self-payment gap before reaching additional cover in the form of an above-threshold benefit. The FlexiFed plan offers members a day-to-day cover in the form of a savings account. Members have the option to either opt for a fixed or flexible Medi-Vault savings arrangement. The Medi-Vault savings have not been included in the FlexiFed rates indicated. These tables reflect the Medi-Vault savings that will be available to members depending on the arrangement they select. Premiums will be calculated accordingly. MyFed is a cost-effective income-based option which offers members the following benefits: unlimited cover for hospital admissions, full cover in hospital for specialists, unlimited cover for medically appropriate GP consultations, blood tests, X-rays, or medicine through the Fedhealth MyFed networks, one out-of-network GP visit, an over-the-counter medication benefit, a chronic benefit, as well as access to the Fedhealth maternity benefit. Monthly contributions are determined on the member's monthly salary. On some of the Fedhealth options, network hospitals are utilized. It is essential for members to make use of approved network hospitals when joining certain plans. If you do not use a network hospital for planned procedures, your hospital claim may not be paid or penalties will be applied. For emergency treatment, members on these plans may utilize any hospital. We're now going to take you through your contributions for the new year. These increases will come into effect after the 3-month increase holiday starting in April 2022.
Where to from here? Should you like to make a change to your option, you can either contact your Nmg consultant or use the Nmg Portal. The Nmg Portal is an online platform used by most of our corporate clients, which allows members to view their personal information, make changes to their options, compare rates and benefits, to name just a few features. This is all done with the highest level of security to ensure your information is kept safe. Should you like to speak to a consultant for more information, please contact us at one of our branches. Kindly note our complaints procedure should you not have been fully satisfied with any information in this presentation. Thank you for your time and take care.